I chose neurology because I practiced as a general practitioner in the mountains of North Georgia for 5 years and realized that there was too much to know in that setting. And the people that we referred to from this very rural area really influenced that a great deal. We had a very strong neurology, neurosurgery group close by in Chattanooga, Tennessee, and I was very impressed with them. So that's pretty much how I chose to do neurology. I went to University High School in Oxford, Mississippi, where my mother was a professor at the university, and following that went to Mississippi College originally, but while I was at Mississippi College, which was fairly expensive, the state was kind enough to allow children of teachers in the state to go to any state university tuition free. So it was a whole lot cheaper for me to go to Ole Miss than it was to Mississippi College, although I love both. And so following my years at Ole Miss, I went to the University Medical Center here in Jackson. And following that, I did an internship in Savannah, Georgia. And after that, I went to the mountains of North Georgia and practiced. And after that, I went to Vanderbilt to do neurology. Our group is a general neurology group, which means we see basically everything. I personally am heavily weighted on the degenerative disorders like Alzheimer's disease and Parkinson's disease. We also see a large number of strokes. I don't do other things such as headaches, and we don't do brain tumors. That's too specialized, but we see basically everything else. The management of patients with degenerative disorders is geared primarily to the patient, but probably 40 or 50% of that management is the family. They are the ones who suffer right along with the patient in each and every setting like this. So what we try to do is we try to supply and provide support for the patient and for the family, as well as medication for the underlying disease that the patient has. As a neurologist, I feel that my role is to provide comfort and treatment for patients who have neurological disorders, including themselves and their families.